Another problem that's faced in nursing and healthcare is employee retention and recruitment. You have high turnover rates, I feel like almost everywhere. Even in these union hospitals, which in California, they seem like they had a pretty high turnover rate too. And they were going through people, and that's just kind of how it is universally because yeah, you have those ratios, but now for example, California, everything is union based. So now everything is union based. So you can't just sell these ratios to these nurses. You have to sell them on a different point because they're mandated already, right? So a lot of nurses are leaving because of hospital politics, because of better employment opportunities to other California hospitals, because that's the bargaining chip they have. They have one satisfied thing, which is the ratios, and now they're also trying to be sold on other aspects, which is, I believe, really good for California because a nurse can focus on achieving other things in nursing, not just kind of focus on the day-to-day activities of like a unit that's poorly staffed or doesn't have ratios.
100%.
Because it's kind of hard to think of like career progression, or it's hard to even progress, go to school and do these things on like a leadership role if you want to attain that. It's hard to do it when your unit is poorly staffed and you don't have the ratios because it leads to a greater amount of burnout. It leads to a poor out of work environment just because you're so stressed at work. It all spills over to your personal life as well, unfortunately.
And this whole retention, also ties into management. So there's a lot of politics that are involved with things. It depends on what's happening with the hospital. When I was a nurse, I thought that everything is based around the patient, right? And the more you do nursing, you kind of realize that everything is based around the business, the money. That's what it all comes down to. So with management, I feel like all they care about is numbers. It's like they treat us like, oh, your barcode scanning is 93%. Like it has to be 97. We have to meet this quota. And everything's always putting us into this like calculated number that they want us to hit. Like it almost like feels like, I'm comparing it to like COVID where we lost patient interaction. They kind of lost that sense with nurses, and it's just like, you are this replaceable person, do this shit, hit these numbers, scan this, chart this, make sure this is all aligned while doing everything else. It's just a whole lot, man.
Yeah. I feel like a lot of people don't know that, let's just say you have Epic, Cerner, all those charting systems. So the reason why we chart on those systems is because that's how the insurance is built. So if you think about it, you might think of Epic as like this giant charting system. It's really not a giant charting system. It's really a giant payroll for how much the hospital charges these insurance companies. And a lot of people kind of think about it that, hey, these charting systems are just for charting because we want to make sure that things are done. But actually on the inside, it's just a way that the hospitals charge insurance companies, which I feel like a lot of people don't know about the charting systems. That's not necessarily just for charting. It's more of a financial thing, which is mind-blowing too.
Even what blew my mind in Texas, where we're barcode scanning everything in the supply rooms. And you mentioned before the show, we're talking like they say that it's for supplies and to kind of make sure everything's adequately staffed, but it's more of barcode scanning. So just another thing we could tag and bill the patient, essentially.
Because I guarantee you it's more efficient to hire one person that just does like unit sweeps. Hey, who needs this? Who needs that? And they bring it up. That's how we did it in Illinois. We had basically a stock supply room, and it would get stocked once a day at least, sometimes twice depending on if they had enough people. And there was literally people coming in, figuring out what we needed to stock, and they would get it and they would restock it. And of course we had like a list in the ICU of our most popular used items, so they would know that, hey, these items are standard, they need to be updated day to day. And here in Texas, like you said, we're scanning them. Like that's so inefficient. First of all, it delays time in between getting the stuff and getting it to the patient because you have to scan. Sometimes it doesn't always scan. You guys scan all the time, so you're just delaying the response time of the nurse, which is going to and can potentially decrease patient satisfaction scores and decrease basically the quickness, I guess, we deliver care, because somebody could die within a few seconds if you're there trying to scan the A-line tubing, instead of just already going to deliver the A-line tubing for the emergency A-line placement,
Also, what I'm thinking about, like retentions and things, wherever we traveled and we noticed there is a void to be filled, a lot of people left, there's a lot of new grads, a lot of preception happening. We've realized that there's leaks and problems in hospital politics, and there's dissatisfaction among the nurses, and it takes a week or two, but everything just starts coming to life. And it's like these repetitive things that we kind of talk about, especially with not having time already, ratios, and then you want to put into having bad equipment. That's another thing across the board wherever I worked. It's super frustrating, always having broken scanners, things out of battery, not having supplies to do my damn job, or tubing other units for supplies. Like, it's just a very repetitive thing. And I understand that supplies are short, or EVS or whoever doesn't stock on the weekends, that gets short, but it happens way too frequently.
Recruitment is another issue I feel like managers have a hard time with. And that's basically, I guess you could say, almost every unit. That's because, like, if you take a manager's perspective, you have two options to hire. You have either A, the new grad, which is you could say a long-term investment, and it also requires a lot of resource dedication because you have to teach this new nurse from scratch. So that devotes a lot of time, lots of resources. And your other option is to get a seasoned nurse that has experience. But then the issue with that, which is hard for managers, is you have to sell them on this position. Because this nurse that's leaving their unit, you have to convince them why you should come on this new unit, because they're going to be leaving a unit that they're already familiar with, that they're already comfortable with, into a new unit with basically an unknown experience. Because when a nurse leaves a unit, the number one goal is to not end up in a worse unit compared to the unit that they left.
Yep.
Right? So that's kind of difficult. So usually you have to sell those people. You could get away with giving a new grad less pay because the new grad is going to be looking for a job actively, right? They want to land that first job and get the experience and get it out of the way, compared to a seasoned nurse where you're going to have to pay them more hourly because you have to give them some kind of incentive. And you're also going to have to show them a good work environment as another incentive, because a nurse does not want to end up in a worse position than where they started from. That's like such a drawback, and that would break any nurse.
And that's why it's important to treat the interview as if the hospital's interviewing you, but it's just as much that you are interviewing the hospital, because you want to be part of a good culture. You want to ask the nurses and manager how things are operated, the diversity, the turnover rate, why nurses recently left, is it management, what's happening there, how is the relationship between days and nights, you know?
If you want to watch or listen to our latest episode,
you can check us out on Apple, Spotify, or watch us on YouTube.